Koronavirüs salgını boyunca hep birlikte cesurca belirsizlikler ve istikrarsızlıklarla yüzleştik. Bir bütün olmaya ve kenetlenmeye devam etmeliyiz. Çünkü şimdi tüm endüstrilerin ve sektörlerin geleceği için yepyeni bir tablo oluşturma zamanı. Bunun geleceğimiz için ne anlama gelebileceği konusunda uzmanlardan görüşlerini aldık.
While it all looks grim and difficult and insurmountable, the one positive side is that COVID-19 has put us in a position of no choice but to rethink and reimagine our delivery of education and learning services to learners of all ages. We now have seen that it is possible for schools to shut down in the entire world, something previously unimaginable, and that we have to have the readiness to deliver education and learning opportunities to learners. Learners across the world are not equally endowed with the equipment, with the connectivity, with the apps, and even with the curriculum materials and learning materials. In addition, teachers are not necessarily familiar and comfortable with delivering their content online and delivering their content digitally.
I want to thank for this opportunity to say a few words about the COVID-19 and its impact on our international community. The only solution in solving this pandemic is to share and handle all information through the public so competence is maximized in a new international order. Thinking it's not my country so it doesn't concern me, or sacrificing another country for my own country's profit cannot be the answer.
Time is what we do with it. In this time of crisis, we have a time to move, to change health organizations, but also our own attitudes and behaviors. In my particular area, this is a time to establish and build the new hospital based on a new paradigm. Not the center for health caring, but just a place of an integrated health system as a provider of high differentiated health caring. Crisis should also be regarded as an opportunity.
This COVID-19 seemed to come out of nowhere. And so I think that liberal democracies in particular are struggling to try to figure out how can we adapt? How can we vote electronically? How can we find ways of restricting our freedom for our health? And I really think that the lessons we can learn is that we all need to be a little bit more humble. We need to take an approach that's not America first, Japan first, any country first, but finding ways of coming together. It's so easy, particularly in the political world, to demonize the other and to say this virus came from here or this is someone else's problems. But ultimately, we're one humanity and this virus doesn't discriminate.
Dentists are at the highest risk of contracting the disease. This is why the role of dental professions in preventing the transmission of COVID-19 is critically important. And all routine dental care has been suspended during the period of pandemic around the world. And we are only providing emergency care with protective equipment, using appropriate gowns, gloves, FFP3 masks, and eye protection. Sterilization and hygiene practices have always been vital in our practice. And from now on, these will be even more crucial.
When we've had these global shutdowns in transportation and industry and so forth, the air has cleaned, right? We've seen a tremendous improvement in air quality in every major city across the world that's had shutdowns. And I'm hoping that that's going to be one of the lasting impacts from this horrible pandemic, is people will see mountains, see cityscape for the first time, and realize, okay, we need to change and we need to change soon.
Both Hollywood and the independent film communities are still figuring this all out and trying to create standard professional guidelines that the entire industry can follow in order to keep their cast and crew safe. Like so many other industries, the film industry is defining what a new normal is going to look like. None of us wants to give up the idea of sitting in the dark, with a big screen rising above us, engulfed in surround sound, watching the story unfold in real time in front of our eyes. For now, we get to rewrite how we move forward. And this can be a good thing. It's a real opportunity to make positive changes that are long overdue, streamlining the process and possibly finding a better way to do things in the future.
The current virus pandemic has had a tremendous effect on the veteran community. We now have currently about 1 million veterans that are unemployed, and we expect that rate to get even higher. We have about 1.4 million veterans that are in the SNAP program and 36,000 veterans that are currently homeless. We also expect that number to go up as well. A lot of our veterans work in the retail and restaurant field, about 50%. And since those areas have been hardest hit, those are the individuals that are having undue hardship at the moment, and we're trying to do everything we can to help them.
Probably we'll be going back to a new normal. We will not be going back to what we used to be the past.
Yes.
So we will be having social distancing, then wearing face masks, and that is mandatory based on our ordinances, the law. It has slowed down the lives of our people. It has affected the economy of our place because of the quarantine. So we were not allowed to go out. And luckily, we only had 5 cases and 1 transfer in from other place. So we have 6 COVID positive cases.
Stay active,
Stay informed, and we are all in this together.